As clinical nurse leaders, we want to ensure that nurses implement best practices to reduce catheter-associated urinary tract infections and improve quality of patients' care.
Urinary tract infections, or UTIs, are common bacterial infections that are responsible for approximately 40% of hospital-acquired infections, or HAIs, every year. UTIs are frequently caused by bacteremia or other opportunistic organisms. 80% of the time, hospital-acquired urinary tract infections are contracted from indwelling urethral catheters. Epidemiological studies show that geriatric populations face the most catheter-acquired urinary tract infections, or CAUTIs, acquired in the hospitals. CAUTIs that affect older patients can cause other health complications, including increased morbidity, sepsis, delirium, restriction of mobility, and possibly even mortality. In addition to health issues, CAUTIs increase hospital bills due to the extra treatments required to treat these complications. Hello, Natalia. As you know, we've been having issues with geriatric patients suffering from CAUTIs. I believe it's important that we take this issue very seriously, so I wanted to go over proper procedure with you. You got a minute?
Sure, Eric. I have a minute. This problem has been on my mind as well. How should we be approaching this?
First, we're going to focus on indications for an indwelling urethral catheter during the nursing shift. This table will help you determine when it is appropriate to use a catheter.
I heard that prolonged usage of an indwelling urethral catheter unnecessarily can increase CAUTI incidence.
That's correct. Also, picking the smallest size of IUC for the patients reduces the risk of infection.
That's good to know. I'm curious about the correct technique for the insertion and removal of IUC. Could you go over it again with me?
Of course. The best evidence-based practices show that nurses should be using aseptic techniques with sterile equipment during the insertion. It is also very important that the urine collection bag is hung below the level of the bladder to prevent reflux back into the catheter.
This sounds fairly straightforward. So, can I do this by myself?
Sure, we can perform insertions of IUCs by ourselves, but it's not recommended. To prevent infection cases and maintain sterility, it is best to have another nurse assist you. While you're preparing your tools for IUC, your partner can be cleaning the patient's meatus with soap and water. After insertion, you should perform regular catheter checkups at least once a shift and routinely empty the drainage bag.
Thanks for going over this with me. Proper techniques for inserting and caring for IUCs are crucial for addressing this problem. Clearly, proper hygiene isn't enough to reduce the number of CAUTIs. I'll let other students know about proper IUC techniques.